Hey guys, Dr. Christy Ennis. Today we are going to go over how to get rid of this awful pain and popping, huge pain and popping, right, from teeny little tiny joint by addressing the muscles in the face, the head, and even the neck, which people tend to forget about, that cause this awful pain and this awful popping. The very first thing you need to know before we even start working on those muscles are two things. Number one is actually the resting position for the jaw. So a lot of times we walk around like this, hopefully you're not quite like that, at nighttime, but even in the day. I am guilty of doing this during the day, so I know that it happens. So first thing to practice is getting the right mouth position. So all it is, and you won't be able to see this completely, but it's going to be lips softly together but teeth apart, and then the tongue is going to be resting on the top of the mouth. So top of the teeth to the top of the mouth, but you're not pushing in. So I'll show you what it looks like, but it might be difficult to see. That's about it. So again, just remember, not teeth together, teeth are open, lips together, tongue resting gently up towards the top of the mouth through those teeth, okay? Even just that will start to relax everything. Number two, before we start working on the muscles, is a breathing technique. Now, when we get stressed, not only do we clench and hike our shoulders, but there's a lot of shallow breathing that goes on. And what research shows is that breathing like that actually tightens up your neck muscles, which is the exact opposite of what you want to be having done. So to practice diaphragm breathing, you want to think about filling up that belly as you breathe in, and as you exhale, let it go. So that you're really breathing more from here than you are from these little neck muscles. And that just calms down the whole nervous system, which you can't go wrong with that either. It'll just make you feel better overall, okay? All right, so now what we want to do is attack gently these muscles that are causing that problem in this darn joint. So we want to get a little bit of blood flow going. And I tried using my hands to do some of this self-massage and found out that I was actually tensing my neck muscles up. So I'm going to use the Derma Edge, which I created and is handmade down in the basement, put together. And it is available online, so I'll link that too, so you guys can order that if you want one. But literally, just taking this surface and doing a little bit of lovely facial massage. Right? So it's just a gentle pressure to get blood flow going, right? So through the masseter muscle, that's that lovely face jaw muscle, through the temporal muscle. And honestly, I usually like heat, but when my jaw and face hurt, I love it to be cold. So sometimes I'll just put it in the freezer for a little bit. And then getting into those, sternocleidomastoid, you do not have to remember these muscles. There's no test. Into the scalenes and even into that upper trap, especially where it's attaching back here. I'm going to show you some other techniques too. So you're just going in one direction until you go, oh, okay, you know, I actually can feel a little bit of blood flow there. My mouth actually opens a little bit better. I know you have a hard time believing that since I like to talk, but it actually does once you get a little blood flow going. And you'll almost feel like a tingling. So it doesn't take very long to do that. Okay, that's step one. Step two is actually doing some trigger point releases. So we get knots in some of these muscles, and you can't just go stretch them out because you actually can make the knots worse. So I'm going to take the edge. I'm going to go into that little masseter muscle, and my left side is always the side I have problems on. So that's why I'm showing you this. So I'm going to dig in, right? If I find my ear hole and come down a little bit, you can even bite down and you'll feel it. I'm going to push in, and then I'm going to open my mouth slightly and go to the right with my jaw. So down. Did you get that? It's like going to the dentist. Push, down, and over. And you're probably going to go, ow, a little bit more. Again, we're doing almost an active release or a pin and stretch into that muscle. So 5 to 10 times until you feel it feel a little bit of a release and a little less tender. Don't dig for dear life, but just gentle. Again, another reason why I'm not using my knuckle, and I've got greasy Italian fingers, so there you go. All right, from there, to get into that temporal muscle, I actually do a little bit of hand on the head. So little push there, and it's a pull and a push that way. You don't have to make that noise. Again, be careful of this. Sometimes I'll just actually, so I don't aggravate my neck muscles, I'll even just do a little back and forth kind of gliding motion right over that tender spot. This is great for headaches too, just so you know that. All right, moving down into the neck. If you can see this muscle, and you can tell that maybe I'm a little tense. So I'm going to go, again, kind of poke around and, oh, yep, there's my tight sore spot. I'm going to push in a little. Again, I'm not hiking my shoulders, right? I'm going to bring my head back, and then I'm going to bend and turn off to that right side. This is what it kind of looks like. And then come back, release. Same idea. So just like we were doing with the jaw, back and over, we're doing that little bit of active motion to get that muscle doing what it needs to do. To get into the upper trap, same idea. Find that yucky tight spot, usually between the shoulder and the ear, kind of midway in between. You just kind of push down and then tilt your head to the side. You don't need to go back or forward with this one. So push, and you can figure out which arm is more comfortable. Sometimes it's this one. Again, we want to make everything else relaxed except what we're working. And then lastly, these darn little bumps in the back of the head are suboccipital muscles. I like to just get in there and, oh, yay. Honestly, again, another great one to do when you have a headache. If you're finding it difficult to reach back here, which sometimes that can be the case, you can take 2 tennis balls and a sock, lie on that on the ground, and then kind of do a little head side-to-side motion. That feels good too if you can't get into this position. Okay. From there, we're going to do a couple different stretches. Now that we've got some blood flow going, those knots hopefully separated. So because it's my left side, that's the side I'm going to show you again. So my left hand is going to go on the top of my head, a little bit over, right, towards the right side. Right hand on the left side of my face, and I'm going to do this kind of motion. So my right hand is pulling down at an angle, whereas my left hand is pulling over. I know it looks funny, but if you've got discomfort here and tightness, this actually feels awesome, okay? So again, really just holding a few seconds here and then letting it go. I find that holding this one for a long period of time can actually be a little bit uncomfortable. So that's why I say just do it for a few seconds and then try to repeat about 10 repetitions or so. I already showed you kind of that stretch for the sternocleidomastoid, but if you put your hand behind the back, that gives more of a stretch. And this one you can hold 30 seconds, a minute, whatever feels good for your body. And very similar for the trapezius muscle. Hand stays behind the back. Opposite hand comes on top of the head. You're not yanking, but just very gently bringing that head over to the side. And again, holding 30 seconds to a minute, roughly, until you really kind of feel yourself relax into that stretch, okay? And my voice even goes more calm as I'm stretching. And then 2 last exercises. Because this is part of it, we want to get rid of that. So 2 quick little posture exercises. A chin tuck, where I'm going to bring that chin straight back. So I'm using these support muscles. And I tell people to try to do 5 or 6 of these almost every hour. Don't bring that chin down, okay? That's the exact opposite of what you want to do. And the same thing for those shoulder blades. It's down and back. And even if you can, even opening up those palms, but not here, okay? Or you're stressing those upper trapezius muscles. So same idea, 5 or 6 or so. And if you need other posture tips, I've got another video that I'll link up in the description so you can check that up there. All right, there you go. You should be feeling lots better just from that today. So thank you so much for tuning in.